Uh, Hi, students. Uh, Good evening, and welcome to this series where we are discussing about the topics which are important for the first MBBS professional exams. And this is the third week of anatomy lectures. And in today's session, we'll talk about the most frequently asked topics from the section of thorax. Uh, Remember, we started last week with the discussion of most oftenly asked topics in neuroanatomy. And today we'll be talking about some of the most frequently asked topics from the section of thorax. So let's get started straight away. What we'll do is first we'll try to see what topics have been asked very frequently from thorax. And then we'll try to discuss two high yielding topics from the thorax. Okay. One which we often read and one probably which we don't. Right. So let's get started with the most frequently asked topics from the section of thorax. And again, we have arranged it as per the chapters in your book. The first chapter, of course, is on the bones and joints of the thorax. So the most frequent question that we get from this chapter of bones and joints of the thorax is, first one is the sternal angle. Okay, sternal angle, otherwise called as the angle of Louis, right? Now, why this question is often asked? Remember, sternal angle is one of the most important landmark in the human body, which actually helps us to count the ribs, especially from the anterior aspect, right? So if sternal angle is asked, like let's say, how do you write it? Very often, let's say this would be a 3-marker question, or occasionally could be a 5-marker, and MCQs can be framed on the vertebral level of the sternal angle. Okay, so angle of Louis. Now, if this is asked, possibly we can start with trying to define what exactly is angle of Louis, right? Then once we define it, then we can talk about the vertebral level, where exactly the sternal angle is formed in the intervertebral disc between L4 and L5. Angle of Louis represents the manubriosternal angle. Then the most important thing is the description of the anatomical events. What events occur at the level of sternal angle, right? Similar to the events that occur at the transpyloric plane, this events occurring at sternal angle is very important. So these three headings, you can describe the sternal angle. Then classification of ribs, feature of typical rib relations, features of typical thoracic vertebrae, all these, if asked, are like 3-marker questions. Classification of the ribs, how do you do it? One way of classifying the ribs is we classify it as true ribs and false ribs, right? So based on their attachment to sternum, first to 7th ribs, which get attached to sternum, are called as true ribs. Then rest of the ribs, which do not get attached to the sternum directly, are called as false ribs. The last 2 ribs, that is the 11th and 12th, are also called as the floating ribs because they do not even reach the costal cartilages, right? So vertebral, then vertebrochondral and floating, right? So this is how we subdivide the true and false ribs. Okay. Apart from this, we also divide ribs into what? Typical ribs, right? And we also have the atypical ribs. Now, typical ribs, remember, are third, right? Third rib to the 9th rib, the first, second, 10th, 11th, and 12th. These are called as the atypical ribs because of the atypical features. Done. So classification and example is what we need to know. Done. Then features of a typical rib. For example, what are the parts of a typical rib that extends from 3rd to 9th rib, right? What are the parts? What are the typical features? Where the intercostal groove is present, in which border, how the rib is divided into various parts from anterior to posterior. All these are asked usually as features of the typical rib. Okay. Again, a 3-marker, not more than this. Then relations of the first rib, especially the relations of neck of the first rib. This is one question that is very frequently asked again as a 3-marker, or this also could come as like an MCQ. What are the structures related to neck of the first rib, right? Remember, the neck of the first rib is related to a sympathetic chain. Okay, a very easy mnemonic we have, it's called as S-VAN, right? So it is related to sympathetic chain from medial to lateral. Then it is related to the first posterior intercostal vein, the first posterior intercostal artery, and then the first posterior intercostal nerve, right? So these are the four structures which are related to the neck of the first rib. Done? Right. Then they will also ask about features of a typical thoracic vertebrae. We know that a typical cervical vertebrae is identified by the presence of, yes, foramen transversarium, right? Now, how do we identify a typical thoracic vertebrae? A typical thoracic vertebrae is identified by the presence of the costal facet. Okay, what are costal facet? Costal facets are the ones which articulate with the ribs. Now remember, the costal facets for thoracic vertebra are present on the upper and lower part of the body, on the sides, and also on the transverse process. Okay, so this is the most typical feature, presence of costal facet on the body as well as on the transverse process. Apart from this, what are the typical features? For example, a long spine which is directed downwards, a long pointed spine which is directed downwards. This is one very important feature of a typical thoracic vertebra. Now, this is how we should describe the features, right? So this is what we need to know from the topic of bones and joints. Are we clear with this? Good morning, Karthik. Good evening, Karthik. Good evening, Hemant. Uh, anything else from the bones and joints of thorax? Forget about rest of the thing. These are the topics you need to be prepared from the topic of the thorax. Done? Right. Bones and joints of the thorax. Now, once this is done, the next important chapter is on the thoracic wall, right? Now, in thoracic wall, what are the questions that you can expect? And these are again from the analysis of question papers of like 2 or 3 of the largest universities of the country, okay? In thoracic wall, the intercostal spaces are often asked as long essay, right? So these are like 10 marker or 15 marker questions. We need to define what is an intercostal space. How do we classify the intercostal spaces as typical and atypical? What are the contents? Now, if it is asked for a 10 marker or a 15 marker, we should describe the contents in detail. For example, the contents of intercostal spaces include the muscles, nerves, arteries, and veins, right? Each of this is in turn a short note or a 5 marker question. Done? So this is what we need to be prepared. Okay. Individual content we need to be prepared with or for a 5 marker question. Intercostal muscles, how the 3 intercostal muscles are arranged from superficial to deep. Where is the neurovascular plane between which muscles, right? All this we need to know. Regarding intercostal nerve, you should be able to draw a neat label diagram of a typical intercostal nerve. How it arises from the spinal cord by dorsal root and ventral root, how it forms the trunk, how it forms the ramus, all that, right? Then intercostal arteries. In intercostal arteries, remember both origin of anterior intercostal arteries and posterior intercostal arteries. How anterior intercostal arteries arise from the internal thoracic artery and how they arise from the descending thoracic aorta, right? Then the internal thoracic artery in turn could be a 5 marker or a 3 marker, right? Again, very often this is one topic that most of us as students would ignore, internal thoracic artery. But remember, this could be a very important 5 marker question from the chapter of the thorax. Done? Right. So this is regarding some of the important topics we need to do in thoracic wall. As I said, one possible long essay from this chapter is the intercostal spaces. Done? Right? So this is regarding the thoracic wall. Now, apart from thoracic wall, the next important chapter we need to know is the chapter of the pleura and lungs. Fine? Hi, Ruth. Hi, Ritu. Good evening. So let's talk about the anatomy of pleura and lungs, from which what questions can come, right? So pleura is again a very important 10 marker for your exam, right? Some of the universities may have it for 15 mark, but the pleura is a topic for long essay, right? Pleural recess is an important 5 marker. Okay. In this, we have 2 recesses that we need to write, right? One is the costophrenic, right? And the other one is the costodiaphragmatic, right? So these 2 recesses, what are the boundaries? What is the clinical importance? All this, right? So pleura, one topic which again is very difficult. Now pleura, when it's asked, maybe like we can just begin our answers with what exactly is pleura, then what are the subdivisions of the pleura, right? Now as we know, pleura is subdivided into 2, right? One is the parietal pleura, and then there is visceral pleura. Done. Then how about the subdivisions of the pleura? How pleura is subdivided into, let's say, cervical pleura, mediastinal pleura, diaphragmatic pleura, right? So these reflections of the pleura we need to remember and write explicitly. Then one thing that they often ask is the reflections of the pleura, where we need to specifically write as we describe it in the surface marking. How to mark the pleura, right? So this is regarding the important subdivisions under which we can describe pleura. Then apart from this, we can talk about the pleural recesses and then the clinical anatomy. Fine. Let me just read this question. Can you please guide what key diagrams and points must be compulsorily included to get full marks? Ritu, can you just type in what topic you're suggesting to any specific topic? Okay. So this is regarding the pleura and pleural recesses, right? Pleural recesses, again, very important 5 marker question, right? Then pulmonary ligament could be an important 3 marker. Done. Then suprapleural membrane, also called as the Simpson's fascia, right? Simpson's fascia is also an important 3 marker for you. And this is one question that we often miss again, right? The Simpson's fascia. What is Simpson's fascia? What is its importance, right? Cervical pleura, it's covered by a thin facial membrane, which is suprapleural membrane. What is its clinical importance, right? So these are the possible questions from the chapter of pleura, right? Then in the topic of lung, everything related to lung is important, starting from its external features, then the bronchopulmonary segments. Both these are potential 15 marker or 10 marker questions, like all are long essays, the external features of the lung and then bronchopulmonary segments, right? Every alternate year, we tend to see a lot of questions on this bronchopulmonary segment, okay? How the lung is divided into 10 segments each on the right and the left. What is its clinical importance, right? Definition. So this is what we need to know in bronchopulmonary segments. Done. Then in the external features and relations of the lung, remember, we need to know about parts of the lung, how the lung is divided into an apex, a base, what about costal surface, mediastinal surface, then what are the borders, anterior, posterior, inferior, what are the structures related to mediastinal surface. And in this, what they usually ask is, in this topic, the mediastinal surface of both the lungs, right? Comparison of mediastinal surface of the right and the left lung, right? Now, this is again a very important 5 marker question. They will ask you to draw a diagram sometimes, and diagram only. A diagram showing the medial surface of the lung, of right lung and left lung. How the structures are arranged in the hilum from anterior to posterior and from above downwards. These are some of the questions you can expect from the chapter of lungs. Okay. Let's read this question again. For a long answer on pleura, types, reflection, and recesses, how should we structure the answer? Should we include surface markings and clinical correlation like pleural effusion sites? Okay. So if, let's say, pleura is asked, we basically begin with defining what is pleura, right? Pleura is a serous membrane that lines the inside of the thoracic cavity. Then we will talk about what are the subdivisions of the pleura, right? So pleura basically has an outermost layer called parietal pleura, which lines the interior of the thoracic cavity, and a visceral pleura, which basically attaches or covers the external surface of the lungs. When it does so, it separates, forming a thin potential space, and that is called as pleural cavity, right? Then we need to talk about organization of the pleura as the cervical pleura, mediastinal pleura, diaphragmatic pleura. Then we need to talk about reflection, how to trace the cervical pleura. For example, imagine we are talking about, let's say here's the clavicle. This is just a diagrammatic representation we are trying to do. This is like the manubrium sterni, and attached to the sternal angle, we have the second rib, third, fourth, fifth, sixth, and then seventh. Now I want to show the cervical extension of the cervical pleura. We know that we need to mark a mid-clavicular point. So join a point above the clavicle to this point above mid-clavicular point, and then towards the sternoclavicular joint, right? Now, this is how diagrammatically we can show. We need not be accurate or very good with the diagrams, but it should be correct. Okay. So one diagram where we can show the reflections of the pleura, the cervical, then mediastinal, diaphragmatic, and posterior or vertebral. This is the diagram they would expect us to draw in the chapter, or sorry, in the subtopic of pleura, right? And then we can talk in the end regarding the clinical anatomy. We can talk about pleural effusion. Then we can talk about pleurisy, right? We can also talk about the pleural tapping. Okay. Now remember, this is also one question that is important. Pleural tapping, or what we call as thoracocentesis. Where do we actually perform thoracocentesis, and what is the anatomical basis? So remember, the lung actually ends at the level of the sixth rib in the mid-clavicular line, eighth rib in the mid-axillary line, and the 10th rib in the posterior or scapular line. So whenever we do the pleural tapping or thoracocentesis, we need to ensure that the pleural tapping is done below this level. Done? So this is how you can actually structure your answer. Done? Right? Ritu, did it answer your question? One diagram showing pleural reflection is a must. Okay? Yes. Karthik has a question for bronchopulmonary segments. Is it necessary to draw the segmental anatomy for both the lungs separately? Absolutely, right? We need to show the segments for both the lungs, right? Because we know that right lung and left lung will have the same 10 segments. But remember, the nomenclature of the segments will differ. So what we do in case of bronchopulmonary segments is, so let's imagine we are drawing the outline of the lung, right? So this is the left lung, right? Now here, when we draw, we need to show the segments for each lung separately. For example, the apical, anterior, posterior, medial, lateral, right? In case of the right lung, we have 10 segments, the nomenclature differs. In case of left lung also, we have 10 segments, the nomenclature differs. That is why it becomes absolutely essential to show the bronchopulmonary segments by drawing separate diagrams for both the lungs, right? And this diagram is enough. We need not draw the subdivisions of the bronchial tree. This itself is enough. Okay? Fine? Yes. Okay. Ritu, I think I've answered. Karthik, is it fine? Did you get the answer for your question? Bronchopulmonary segments, we have seen questions on this very repeatedly. Okay. So in the entire chapter of pleura and lung, I would always bet my money on the bronchopulmonary segments, mediastinal surface of the lungs comparison, then the pleural recesses. Okay. If the examiner wants it to make little bit tougher, he can directly ask about pleura for a 10 marker. But there are high chances that every exam will have a question on bronchopulmonary segments, then mediastinal surface of the lungs, and also the pleural recesses. These are the three topics that I would never skip if I'm preparing for my first MBBS exam. Right? Done. Okay. Right. Fine. Now, let's talk about the next subtopic, that is mediastinum. A very easy topic. You can score heavily if you can spend some time in this topic. Okay. Mediastinum is one chapter where all you need to do is you need to learn the boundaries and contents. Okay. List the boundaries, list the contents. Done. In the subdivisions of the mediastinum, again, the most often asked mediastinum is posterior mediastinum. Okay. Compared to any other mediastinum, posterior mediastinum is often asked only for the reason being there are a lot of structures in the posterior mediastinum. Done. And each mediastinum, all you need to know is how to define the boundaries. Okay. How to define the boundaries and how to list the contents. Remember, in mediastinum, they will not ask you to describe the structure for, let's say, 5-marker questions. Okay. Only posterior mediastinum is a 5-marker. Okay. The rest of it will be 3-marker questions. And you can get MCQs on it, of course. Right. So posterior mediastinum, we should be able to define the boundaries and list the contents. At least you should be able to name them. Now, in the posterior mediastinum, there are 3 structures. Of course, they are described separately in your thorax textbook, but esophagus, thoracic duct, azygous vein, each of them are short notes or 5 markers. And occasionally, esophagus and thoracic duct, these two have been asked even as 10-marker questions. Once in Rajiv Gandhi University, we had a question on thoracic duct for 10 mark. Right? And esophagus also could be asked as 10 mark, right? 10-marker question. Now, in esophagus, one more thing I want all of you to learn thoroughly is regarding the constrictions. Okay? Constrictions of the esophagus, right? This is a very favorite topic of your paper setters. Could come as a 3-marker, a 5-marker, or even MCQ question, right? This is a perfect material for a case-based question. Right? Imagine the question could be framed something like this. A 40-year-old man comes with complaints of dysphagia, and for further evaluation, upper GI endoscope was referred to. On doing upper GI endoscopy, what are the possible sites at which the endoscope can go obstructed? Okay. What are the sites where it can get obstructed? So they are referring to the anatomical constrictions of esophagus, at what levels they lie. Fine. This is what is required. Thoracic duct, again, a very favorite question for paper setters. Remember, most of the students, why they don't study all the topics in thorax is, they think that from the chapter or from the entire section of thorax will have 10, 15, 18 marks. What I'll do is I'll skip this 18 and then I'll study something else. The mistake is there are limited number of questions in the entire section of thorax. Okay. If you read these limited questions, these 15 to 18 marks are guaranteed. Done. This is why you should never skip thorax. Okay. Most of us would read heart, pleura, and leave it at. Okay. But if you can go through all the topics that we are listing today, believe me, it will help you score maximum marks in thorax. Done. So thoracic duct, be prepared. Fine. Okay. Division of mediastinum, Ritu, middle mediastinum, superior, boundaries and contents. Yes. All the mediastinum, just remember how to list the boundaries. Okay. How to list the contents. No description at all. Fine. If you can draw a simple diagram as, let's say, we are showing, let's say we want to draw the superior mediastinum or the middle mediastinum. So let's imagine we are showing the manubrium sterni. Now let's imagine this is the outline of the body of the sternum and the xiphoid process. So this is our sternal angle and we have ribs, right? T1, T2, T3, T4, T5, T6, T7, T8, T9, T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Okay. So here we can show the diaphragm, and here we can show the thoracic inlet, right? And this is the sternal angle of Louis, right? So the boundaries are ready now. Done. So this is possibly the simplest way in which you can show the diaphragm. And we know that the inferior mediastinum is divided by what? The pericardium and the heart present inside it, right? The pericardium and the heart present inside it into an anterior, a middle, and a posterior mediastinum. So a simple diagram as simple as this will fetch your marks. Okay. Again, I'll reiterate, as we discussed in the first two classes of head and neck and neuro, nobody will look for artistic diagrams. Okay. They should be anatomically correct. That's it. Done. So this is how we can simply do it. If you can explain something with the help of a diagram, nothing like it. Okay. The examiner possibly will not even read your answer. Done. So this is regarding the mediastinum. Done. Karthik, I'll come back to it. How do we balance writing about thoracic duct versus other lymphatic channels like bronchomediastinal trunk and parasternal nodes? Karthik, I'll definitely come back to that. One of the topic that we will be discussing today is thoracic duct. So we will discuss about it. Okay. So superior mediastinum, anterior mediastinum, middle mediastinum, boundaries, contents. In the superior mediastinum, one question that can come is question on superior vena cava and arch of aorta. More likely to be 3 marker, at maximum 5 marker. Okay. Superior vena cava, arch of aorta. You should describe vein and artery like any other blood vessel in the body. That's it. Okay. Don't worry too much. But here, as I said, one of the most important topic would be the thoracic duct. Done? Right. Then comes the pericardium and the heart. Okay. Now, in the pericardium, pericardial sinuses again are a very important 5-marker question. Okay. Both oblique pericardial sinus and transverse pericardial sinus, sometimes they give specific sinuses, but very often they'll ask you about pericardial sinuses in general. Okay. So you should be able to describe this. Done. Then external features of the heart. External features of the heart are very important for your practical exam, where it will be asked as a discussion topic or an auscultation, right? Rarely they can ask you about external features, but you should be ready with what is the base of the heart, what is the apex of the heart, what are the surfaces, what are the borders, what are the grooves, all this. Okay, external features is something that you cannot ignore. Since you need to prepare for your practical also thoroughly from the chapter of heart, it is always advisable to go through the external features first. Then, if anything is asked in heart, it would be more often the internal features and then the blood supply. Okay. Even in the internal features, most often they focus only on the right atrium. Okay. We have seen a lot of questions on right atrium, but not any other chambers. But it is better to be prepared for all the 4 chambers, right, left atrium, right, left ventricle. Okay. We know that the questions have been asked on right atrium only, but you never know. Examiner might decide, okay, let's ask a little bit about the ventricles also. Remember, it's not that difficult, the interior features. So it's better to be prepared for all the 4 chambers, right? Again, the blood supply of the heart. Fine. Given a chance, every exam, every first year anatomy MBBS exam, I would include this question. This is something that every medical student must know, right? Not for exams, but because the cardiovascular and cerebrovascular disorders are like #1 killers in India, right? This should make us read more and learn everything about the blood supply of the heart, right? So this is one topic that you should always be prepared with, right? If not long essay, you will definitely get at least a 5-marker question or even MCQs, right? Even if you're not getting a question, this is one topic that you would not prepare just for your theory exam. This could save someone's life, right? Now, since we have talked about like the topics which can very often be asked in your exam, I thought let's discuss few important topics. Okay. I know in 45 minutes to 1 hour, we'll not be able to discuss everything. But what I've given in the first half an hour is I've given you an overview of what are the topics to be prepared from thorax. Now, one of the most important question in the section of thorax is regarding the arterial supply of the heart. So let's spend some time trying to learn about the arterial supply of the heart. And after that, Karthik, we will talk about the lymphatic drainage and we will focus on the thoracic duct, right? So arterial supply of the heart, a very important long essay. Remember, whenever they ask about blood supply of any organ, we will talk about the arterial supply and then we will talk about the venous drainage, right? So this is the first thing that we need to remember. If blood supply is asked, it is understood that the examiner wants us to write both arterial supply as well as venous drainage. Done? Right. Now here we need to specifically talk about arterial supply. So let's try to learn. In the venous drainage of the heart, one question that we have seen almost every alternate year is on the coronary sinus. Okay. So this is one question that I would be always prepared in the chapter of the heart. Done? Right. So this is regarding the arterial supply of the heart. Let's try to learn and let's get started with how to present an answer if arterial supply of the heart is asked. Okay. The first thing that we would always begin with is the arterial supply of the heart, right? Arterial supply of the heart is by two coronary arteries. Okay. Two coronary arteries, right? Right and left. Now we need to talk about each of the arteries in detail. Fine. We can do it in the form of a table, or let's say we start with the right coronary artery. Okay. Now, right coronary artery, what we would write? We need to talk about the origin, right? Then we need to talk about how the artery terminates. Then we need to talk about the course, then branches, and the area of distribution, right? Area of distribution, and finally, the clinical anatomy. Imagine if you can describe the arterial supply of the heart for a single artery under these headings. Nothing else is required, right? You are structuring your answer so beautifully that the examiner would need to spend less than few seconds to go through what you have written. Done? The same we need to do for the left coronary artery. The same headings, fine? This itself, you can convert it into a beautiful table. But in the arterial supply of the heart, the examiner will definitely expect you to write a diagram of the arterial supply. Let's try to understand how do we do it. Okay. So how do we start with the diagram of the arterial supply of the heart? Fine. So what we'll do is we will draw the outline of the right atrium to begin with. So let's imagine this is the right atrium and this is the part of the right ventricle, and then we have the left ventricle, and then here we have the left ventricle forming one of the left surfaces of the heart. So this is close towards the apex where we have the opening of, let's say this is the superior vena cava, right? So this is the superior vena cava opening. On the side of the superior vena cava opening, we have the largest artery coming from the heart. So let's take this as the arch of aorta, right? So let's take this as arch of the aorta and let's take this as the left auricle. Done? Then we need to write one more blood vessel here. So let's imagine this is the pulmonary trunk, right? This is the first thing that we need to write. And then in this single diagram, we can talk about the entire arterial supply of the heart. So first, let's start with the right coronary artery. The right coronary artery originates from a aortic sinus. Okay. Now, what aortic sinus? So remember, the origin is from anterior aortic sinus. Now, let me take a minute here to explain what is anterior aortic sinus. Imagine we take a section of the ascending aorta here. how does it look? So it basically looks like this is how the aorta looks at its origin. This has three important valves or the cusps of the valve, which actually look like, okay. Now, can you tell me what is this looking like? So what is this sign or how this sign actually looks? This is like the Mercedes-Benz sign, right? Now, these are the three valves of the ascending aorta, right? Now, see if we can draw this diagram to describe the origin. Now, the spaces between the wall of the aorta and these cusps are called as, this is called as the anterior aortic sinus. Okay. This is the left posterior aortic sinus. This is the right posterior aortic sinus. Why we need to know this? The right coronary artery takes its origin from here. Okay. The anterior aortic sinus. Whereas the left coronary artery takes its origin from here. This is the left posterior coronary sinus, or just called as the posterior coronary sinus. Remember, the right posterior coronary sinus is always referred to as the non-coronary sinus because no coronary arteries will come from it. Done? So this is regarding the origin, anterior aortic sinus. Now, if I'm talking about the left coronary artery, what is the origin? The left coronary artery is taking its origin from the posterior aortic sinus or left posterior aortic sinus. Done? Right? Okay. Now, let's talk about the course. Termination, we will write. Once the right coronary artery arises, it passes between, let's say we have the right auricle here. Okay, it passes between what two structures? One is the right auricle and then the pulmonary trunk. Okay, this is the origin of the right coronary artery, and it reaches the right border of the heart, passing along with the right atrioventricular groove. Done? Remember, atrioventricular groove is like a C-shaped sulcus which completely encloses the heart. Anteriorly, it is deficient because of the origin of ascending aorta and pulmonary trunk, right? So this is called as the first segment of the right coronary artery. So course, we can divide it as the first segment and the second segment. The first segment extends from the origin to the right border of the heart. Done. Then from here, the artery turns backwards, right? It runs on the diaphragmatic surface of the heart. Okay, so you can show it in dotted line once it reaches the crux of the heart. Now, what do we mean by crux of the heart? Crux of the heart is the area where the interatrial groove which separates two atria, then the posterior interventricular groove which separates the posterior part of right and left ventricle, and also the posterior part of atrioventricular groove. All of these three meet. This point is called as the crux of the heart. Done? So at the crux of the heart, it anastomoses with the left circumflex artery. We will draw the left circumflex artery a little bit later. Now, this segment is called as the second segment of the right coronary artery. So this is what we need to write in course. First segment, origin to the right border, from the right border to the crux, the second segment. The parts, these parts, the first segment rise in the right part of atrioventricular groove. The second segment lies in the posterior atrioventricular groove. Done. What about the branches? Okay. Now, termination, we have an idea. So this terminates by what? By anastomosing with the left circumflex artery. Okay, we will see it when we discuss about the left coronary artery. Done. Now, what about the branches? Remember, branches again you can divide as first segment and second segment. Here you can further divide it as the ventricular rami and atrial rami. So this also ventricular rami and atrial rami. Nothing but the branches which supply the ventricles and which supply the atria. That's it. Okay. So from the first segment, the very first branch it gives off. Okay. This is called as the conus artery. Right. This is the first branch that supplies the infundibulum. Now, this is what I mean by area of distribution. Now, how you can further summarize this? So this is, let's say, the branches of the right coronary artery. Okay, so what we can do here is we can actually talk about the branch name and we can talk about area of distribution. So the first branch we are talking about, let's say, is the conus artery. And here we would write this will supply the infundibulum of the right ventricle. This is how your answer should be, right? Every artery that you learn, not just the coronary arteries, name of the artery, and then the area it supplies, the area of distribution. This is what is a must. Done? Right. Now, first branch, first ventricular branch, conus artery. Then it gives off ventricular rami, which will supply the right ventricle. Okay. Then atrial rami supplies the right atrium, but one of the most important branch that supplies or comes from the right coronary artery is an artery which supplies the SAN. Okay, the SAN artery. Done. So in ventricular rami, we were talking about the conus artery, right? And then we talked about the ventricular rami. In atrial, of course, we have the atrial branches, and one of the atrial branches is called as the SAN artery. Done. So this is how we will describe the branches. Then what about second segment? Remember, the second segment will give rise to, of course, the ventricular branches, and also it gives rise to the atrial branches, which will supply both right atria as well as left atria from the posterior aspect. But remember, the most important branch that is ever given by the right coronary artery is an artery which runs in the posterior interventricular groove, and we call this artery as the posterior interventricular artery, right? The most important branch of the right coronary artery, because this decides the coronary dominance. Okay, this decides the coronary dominance. If the posterior interventricular artery comes from right coronary artery, we call it as right coronary dominance. If it comes from left coronary artery, we call it as left coronary dominance. Remember, in 60% of the individuals, it is right coronary dominance. Now, this is regarding the most important branch of the right coronary artery. Now, where does it supply? As the name suggests, it supplies the posterior part of the diaphragmatic surface of the ventricle. But one of the most important thing you must remember here is it supplies posterior 1/3 of the interventricular septum. And this is what the examiner will look for. Okay, let's highlight it in a different color. So this is what the examiner will actually look for. Done. This you must never miss. Right? Posterior interventricular artery supplies which part of the heart? Done. So this is regarding the brain branches coming from the entire right coronary artery. So we have talked about branches, we have talked about the area of distribution. What will you write in clinical anatomy? Clinical anatomy for both the vessels could be occlusion of these coronary arteries can lead to ischemia, and this can lead to myocardial infarction. Whenever it causes ischemia and pain, we call it as angina. Whenever it leads to death of cardiac tissue, we call it as myocardial infarction. Done? So this is how we should describe the right coronary artery. Similarly, what about left coronary artery? Now, left coronary artery arises as a branch of the posterior aortic sinus, runs between the left auricle and the pulmonary trunk. The artery immediately divides into a circumflex branch and then an anterior interventricular branch which runs towards the apex of the heart, running across the apicus insusura cordis, right? The cardiac notch, to be specific. Okay. So what is this? This is the left circumflex artery. And what is this? This is the left anterior descending artery. Do you know what is this artery otherwise called as? This left anterior descending artery? Anybody? Anyone in the group? Can you tell me what is this left anterior descending artery otherwise called as? Remember, this anterior descending artery is otherwise called as the widow maker's artery. Right? Now, why it is called as the widow maker's artery? Because this left anterior descending artery supplies the anterior surface of the right ventricle and the left ventricle. And then the fate of this artery is it passes posteriorly where it anastomoses with the posterior interventricular branch of the right coronary artery. Okay. Now, this also supplies the posterior part of the right and left ventricle, but this artery mainly supplies the anterior 2/3 of the interventricular septum. Okay. Now, because of this, we refer this as a very important artery, right? Now, since majority of the heart is supplied by this left anterior descending artery, 100% occlusion of this artery often results in death of the individual. That is why we refer it to as the widowmaker's artery. Done? So, origin, left posterior aortic sinus, termination by dividing into left circumflex and left anterior descending, right? Then what about branches? Branches, we have discussed about 2 branches. It splits into 2. Then we need to talk about individual branches of the left coronary artery. For example, what is the fate of left circumflex artery? The left circumflex artery will anastomose with the right coronary artery at the crux of the heart. Fate of the left anterior descending artery, we have already learned. Now we need to talk about the branches. The left anterior descending artery supplies the ventricular branches. It gives off a conus artery. Occasionally, it gives off a large branch called as the left diagonal artery. So now, split the branches of the left anterior descending and left circumflex artery and write the areas supplied by them. Again, I want you to remember these headings. Even the left coronary artery go on describing under these headings. Imagine you have a 10-marker question and you have described both the arteries, let's say under 6 headings each. What else the examiner would expect? And this is the only diagram that you need to write. No other diagrams, right? One single diagram showing the arteries of the heart. This is all that we expect from you. Done? This will be a very important 10-marker question for your upcoming exam. Okay? This is something that you cannot skip. Done? So this is regarding the arterial supply of the heart. As I said, venous drainage, read about coronary sinus. Again, a very important 5-marker, as I said. Okay? Once we have learned this, let's talk about the thoracic duct. Thoracic duct, occasionally, I think once it was asked in RGHS as a 10-marker question, but it has every potential to be asked as a 10-marker. Done? So let's try to understand about thoracic duct. This would be the next topic, and this would be the last topic that we will be discussing for the day. Okay? So let's talk about the thoracic duct now. If thoracic duct is asked and they have not given the headings, how would you describe the anatomy of the thoracic duct? Remember, we would always begin with what exactly is thoracic duct. Okay? So what is thoracic duct? Thoracic duct is the largest lymphatic channel of the body, right? The largest lymphatic channel of the human body. This is the definition. What is the area of drainage? Okay. Now, area of drainage, remember, it drains the entire body. It drains the lymph from entire body except. How to easily remember it? Let's imagine we are drawing a simple human being, right? So let's imagine this is the trunk, and let's say this is the right upper limb. Okay, this is just a diagrammatic representation. So this is like the lower limbs, right? Now, what is the area of drainage of the thoracic duct? Remember, the thoracic duct drains every part of the body except the right half of the head and neck region. Okay, the right of the head and neck region is not drained by the thoracic duct. Then right half of the thorax. Okay. So let's say this is the diaphragm, right? Then it drains the entire. So this is the area that is drained by a lymphatic channel called as, right? This entire area is drained by right lymphatic duct. Okay. The rest of the area, whatever we have, everything is supplied by, or sorry, drained by thoracic duct. So remember, right head and neck, right part of the thorax, right pleura, right lung, right surface of the liver, right upper limb. These are the areas which are never drained by thoracic duct. They are drained by right lymphatic duct. Rest of the areas are drained by the thoracic duct. Okay, this is the area of drainage. Then what about the extent? From where to where this thoracic duct extends? Remember, the extent of the thoracic duct is from T12 vertebra to the C7 vertebra. This is again very important, right? This is the complete extent of the thoracic duct. Done. What about the measurements? Again, this is one question that we often get in Viva. Why? Because the length of the thoracic duct, remember, is about 45 centimeters. And let's say its diameter is about 5 millimeters. Okay. That much smaller diameter the thoracic duct has. Done. So this is regarding the measurements. These are the initial things we need to mention about thoracic duct even before we go in depth. Okay. This is one diagram which we can always mention to talk about the area of drainage. Done. So once you have written these 4 headings, right? The next important headings are, we need to talk about how it is formed, how does it terminate, what is its course, and then we can talk about tributaries and relations, right? Now, let's try to learn how to draw the diagram for thoracic duct. Again, most of us are scared of like learning this diagram. Now, let's see if we can make it a little bit simpler. So what we need to do is, we need to draw 3 important vertebral landmarks. So let's imagine this is C7. And one vertebral landmark we need is T5. And one more vertebral landmark we need is T12, where it begins. Okay. Apart from this, we need to draw few preliminary blood vessels. Okay. So on the right side, so let's imagine we have the right right internal jugular vein joining the right subclavian vein, forming the right brachiocephalic trunk. The right brachiocephalic trunk will receive the left brachiocephalic trunk, okay, which is formed by, again, we have the left internal jugular vein uniting with the left subclavian vein, okay. Then draw the outline of the superior vena cava. So this is the superior vena cava. Done. This is one blood vessel we need to write. Then the second blood vessel we need to write, let's say, is, we know that the abdominal aorta is a continuation of the descending thoracic aorta beyond the aortic opening of the diaphragm. And this lies at the level of T12. Okay. Then just continue this above, right? So from T5 above, what it should continue as, we know that there is arch of aorta, right? So let's imagine we are showing this as the arch of aorta. Done? Right. Then one more important structure we need to write here is the esophagus. Okay. So let's imagine this is the esophagus, right? So this is the esophagus. Now we need to write one more blood vessel which actually opens into the superior vena cava. And this lies on, let's say, the right side. Okay. So what is this channel? This unpaired channel we have which opens into superior vena cava by forming an arch. This is the azygous vein. Done. So let's label them. This is superior vena cava. This is left brachiocephalic trunk. This is azygous vein. This is abdominal aorta. Done. Now let's try to learn about the thoracic duct, how to draw the diagram. Done? So start with cisterna chyli. Okay? Cisterna chyli is the largest lymphatic channel that is present in the abdomen. Remember, the human body will have 3 peripheral hearts. Peripheral hearts are the structures which will increase the venous return. For example, cisterna chyli in the abdomen. Then we have the lateral pterygoid, contraction of which will push the venous blood towards the heart, right? And the third venous pump or the third peripheral heart we have is the soleus muscle, right? Through its venous pump, it improves the venous return. Okay. So this begins as a continuation of the cisterna chyli at the level of T12 vertebra. Remember, at the T12 vertebra level, we have the aortic opening, right? So through the aortic opening, we have the passage of the abdominal aorta. Then we have the thoracic duct. We also have the azygous vein. This will be an MCQ for you. Done? Right. So what will we do next to draw the thoracic duct? Thoracic duct, all we need to do now is show the thoracic duct until the T5 vertebral level as a beaded structure. Okay. So it is a beaded structure present in the thoracic cavity, mainly in the posterior mediastinum. At T5 level, what happens? At T5 level, this crosses to the left side, right? And then it ascends on the left side of the thorax, right? So sternal angle is the level where the thoracic duct deviates from the right side to the left side, and you must show this deviation here. Very important. Okay. Every examiner would look for this deviation. Done? Then this thoracic duct passes onto the neck, where opposite to the transverse process of the C7 vertebra, it joins the junction of these two veins. Now, what are these two veins? Remember, this is the left internal jugular vein. And what is this? This is the left subclavian vein. Is this difficult? No, right? This is all we need to draw. One diagram to show the formation, termination, and relations of the entire thoracic duct. If you can draw this diagram, believe me, even if you make a little mistake in describing the relations when you write it, that can still be ignored, because most of the examiners may not look beyond this diagram when they're correcting thoracic duct. If you have written these headings, written the diagram, and written the structures related, even if there is one or two mistakes, that might be ignored. I'm saying might be, not always. Okay. So formation, termination, we have known. Course. So course, it starts by passing through the aortic opening, runs in the posterior mediastinum until it reaches the T5 vertebral level. At T5 vertebral level or at the level of sternal angle, it deviates to the left side, ascends in the superior mediastinum, comes to the root of the neck, where it arches to drain or terminate at the junction of the left internal jugular vein and the left subclavian vein. So when you write the course, mention about aortic opening, posterior mediastinum, superior mediastinum, neck, 4 points. You need not write everything, these 4 points. Then if you can remember the relations, nothing like it. Okay. What are the relations in the aortic opening? For example, anteriorly, we will have the median arcuate ligament. Posteriorly, we will have what? The T12 vertebra. On the left side and the right side, even in the posterior mediastinum, the relations are the same. So here, left and right, we have abdominal aorta and azygous vein. As we come above, right? So what do we have in the posterior mediastinum? We have the esophagus covering it. Posteriorly, we have the vertebral bodies of T5 to T12. On the right side, we have azygous vein. On the left side, we have abdominal aorta. That is why I said drawing this diagram, practicing this diagram and learning this diagram is very important. Done? Karthik, this is one diagram that we must learn to describe the thoracic duct. Then we need to talk about the relations in the superior mediastinum. Superior mediastinum, we know that there is no descending thoracic aorta, there is arch of aorta. So anteriorly, there is arch of aorta. Posteriorly, there is the thoracic vertebra. On the right side, we have the esophagus, right? This is how you need to remember the relations. Mugging up the relation is not an option. Draw the diagram, try to learn the relations. Done? Then, once we have talked about course and relation, let's talk about tributaries, right? For tributaries, if you have time, you can draw one more diagram showing all the tributaries. If you don't have time, just list the tributaries. For example, let's say in the region of the neck, we'll just draw in this only. So we have the left jugular trunk. This is one tributary. Then we have a left subclavian trunk, and there is a left bronchomediastinal trunk. These are the three tributaries. Then when we come to the thoracic wall, right, we have the the intercostal tributaries, right? So we have the intercostal tributaries draining into the thoracic duct. Then if we come further down, let's say we have the descending lymphatic trunk. The descending lymphatic trunk, remember, receives the lymphatics from the lower 6 intercostal spaces. Done. The upper 6 will directly drain into the thoracic duct. The lower 6 will form the descending lymphatic trunk and will drain into it. Fine. This is what we need to talk about tributary. What about clinical anatomy? Remember, rupture of the thoracic duct will lead to a clinical condition called as the chylothorax. Okay. Now, what is chylothorax? When thoracic duct ruptures inside the thoracic cavity, it can lead to accumulation of the chyle or the lymph into the pleural cavity. And this condition is what we refer to as the chylothorax. Done? So this is how you should describe it. Imagine thoracic duct is asked for a 5 marker and you have described it under the heading of what is it? That is definition. What does it drain? Area of drainage. What is its extent? Measurement. Formation, termination, course and relation, tributaries. Then you talk about clinical anatomy. Where would the examiner cut the marks? Right? This is why I keep stressing on structuring your answer is what will get you the maximum marks. And a simple diagram, a simple line diagram, which is anatomically correct, is all that we expect. Done? So this is how you should describe the thoracic duct. Karthik, hope this answers your question. Right? So this is what I wanted to discuss, right? In the entire section of the thorax. Remember, there are questions that we started. Like we started with what are the most important questions that are frequently asked. And then we discussed about 2 important questions that can come in your exam. Okay, one is arterial supply of the heart and the other one is the thoracic duct. Okay, please be prepared for these 2 topics and the topics that we listed. Okay, as I said again, thorax is a scoring section. Okay, limited number of questions. Similar to your neuroanatomy, thorax, there are limited questions that are asked in UG exams. And if you have gone through previous 4 or 5 years exams, nothing like it. You will be able to answer almost 90 to 95% of the questions. Done? So this is regarding the thorax. If you have any questions, I would like to take up before we close. If there are no questions, I again want to bring it to your notice that in next week, we will be talking about the topics of the upper limb. Okay. On 30th June, we will talk about the topics of the upper limb. So please do join for the session. And if you have any particular topic to be discussed, okay, please do drop in a message so that I'll be able to address those questions or address those topics in the upcoming class. Okay. If we do not have any queries, I would thank you all and all the best for your internals, which is, I think, upcoming, and also for the upcoming exams. See you next week in the discussion of the topics of the upper limb.